Audio Jungle.
Good morning and welcome to QTV News Platform. Nigeria moves to close health financing gap, demands action from states. The Minister of Health and Social Welfare, Professor Ali Pate, has called for increased public spending and effective use of revenues from health taxes on tobacco, alcohol, and sugary drinks. He made the call at the just concluded National Health Financing Dialogue in Abuja. Our correspondent completes the story.
At a four-day dialogue in Abuja, Professor Pate emphasized that channeling additional revenues from health-related taxes into the sector will help close Nigeria's wide financing gap and reduce the burden on citizens. He noted that, despite ongoing reforms, out-of-pocket spending remains high, leaving millions of families vulnerable. Citing China's experience, the minister stressed the need for a stronger fiscal position to achieve universal health coverage.
Now we are seeing our revenue to GDP going up to more than 11%. I think this is the first time in many, many years. As revenues improve, obviously, health and other sectors would then be invested upon. And the states in particular are also seeing much of the windfall. As a total of 34 states recorded an aggregate surplus. In addition to the FAC increase, states' internally generated revenues also grew by 46%, reaching 2.9 trillion, almost 1% of GDP, while grants and aid tripled, I believe, over the last several months to 0.5% of GDP, further strengthening the state financing. And we also understand there is a policy framework on excise, on tobacco, alcohol, and sugar-sweetened beverages that is being developed. Thus, we have an important opportunity to leverage additional public financing towards health spending using the instrumentality of the health taxes, because you hit two goals. You achieve public health objectives. Given the rise in non-communicable diseases, if you reduce tobacco consumption and moderate the SSBs and others and alcohol, I think you have a public health benefit, but you also have a fiscal benefit from the finance. So there's a double win in there.
Professor Pate further urged states and local governments to take greater ownership of primary healthcare financing, insisting that federal resources should only play a supportive role.
But it's a trade-off that will have to be carefully considered, because there are also other aspects which the Minister of Finance is very aware and is trying to manage. I think it's clear the message to all of us is that we have to collectively own the issue of health financing. And for primary health care in particular, which by policy it's at the state level, the federal contribution through BHCPF, NHIA, and the pool funds that we've mobilized exist to support. But the primary responsibility should be at the states and local governments. And that we urge the states and local government to increase and the health budget and also release them in line with the compact that we had signed, making health a budget priority, and that all the allocations are released.
Also speaking, the Minister of Finance, Wale Edu, highlighted ongoing tax and structural reforms aimed at creating a more sustainable base for healthcare investments. He underscored the importance of collaboration between health and finance authorities to drive the reforms.
We have signed into law comprehensive tax reforms, simplifying compliance, reducing nuisance taxes, and strengthening administration. And we are driving structural reforms in energy, education, logistics, such as the CNG initiative. And importantly, we continue to build, using digitization, automation, and technology, a social safety net that is getting more and more robust, that allows intervention directly to people who need it.
The Abuja conference concluded with a renewed commitment to making healthcare affordable, accessible, and sustainable through shared responsibility across all levels of government. Vincent Okushi, QTV News.
Audio Jungle.